Hi, this is Taryn Moore again doing a video on managing health information and technology. Um, so I chose to talk about patient falls. So first of all, I start off nursing sensitive quality measures. NSQIs are proxies that are more specific to the quality of nursing care and its correlation to patient outcomes. These measures have established themselves as variables that can be assessed from a nursing perspective and represent a significant aspect of nursing practice that affects patient health and safety. Therefore, these indicators constitute an important consideration in determining the efficiency of nursing interventions. Common aspects associated with patient falls, pressure ulcers, and medication errors, as well as patient scores on the Patient Satisfaction Index, are all directly linked to the quality of nursing care provided. NSQIs influence healthcare governance and patient care delivery positively, although they are not merely measures of nursing performance. The relationship between the direct impacts of NSQIs on patient outcomes is significant. Evidence suggests that improvements in nursing care reflected by an increased focus on patient-focused metrics in particular have a relationship with increased patient recovery, reduced mortality, and greater patient satisfaction. Improving nursing methods for preventing infections, example, hand hygiene and compliance with infection control guidelines, can result in a decrease in hospital-acquired infections. Hence, data from NSQIs is not only informative for nursing performance, but also important for enhancing patient safety outcomes. This link emphasizes the necessity for nurses to respond to these signs and indicators, not only in terms of compliance, but by means of providing a culture of continuous quality improvement. The evolution of nursing sensitive indicators has occurred over the years, although ongoing interaction between nursing researchers and healthcare professionals around the globe has necessitated valid and reliable measures. Gormley, Conley, and Ryder, 2024, outlined the NSQIs are developed and supported in the nursing theory and empirical practice and thus are applicable to modern practice. These indicators are typically developed in collaboration with nursing organizations, institutions of higher education, and health policy specialists to ensure that they are representative of relevant clinical practice and can be implemented in health services across jurisdictions. Such collaboration is necessary to develop benchmarks that not only emphasize the integral role that nurses play in patient care, but also reflect the changing nature of healthcare settings. It is imperative that new nurses are aware of both the methodology of data collection and the need for accuracy regarding their use. Nurses, as frontline practitioners as we are uniquely positioned to document patient care and outcomes accurately, which is critical as they directly shape the data used to inform these indicators. Thus, participating in these methods contributes to a strong quality improvement structure, which is crucial to ensuring patient safety. New nurses can develop a comprehensive understanding of nursing sensitive quality indicators, ensuring they can participate fully in the holistic interventions that improve healthcare quality in interdisciplinary practice and create an organizational culture of safety. Data collection and dissemination were at the heart of monitoring and improving nursing sensitive quality indicators used to monitor how nursing care influences patient outcomes. An extensive collection of information has been facilitated through the development of various methods and tools that support new nurses in understanding the degree and importance of these indicators. Widely used techniques include electronic health records, patient satisfaction questionnaires, chart audits, incident reports, and direct observation. These resources provide useful evidence from patient feedback, including quantitative measures like infection rates, readmission rates, and patient fall rates, as well as qualitative ones that may highlight possible areas for improvement. With the help of these different ways of collecting information, nurses can create a picture of health and care quality, also called the overall picture, and how effectively it works, which can be followed up with a plan to determine the care that needs to be delivered. It is also important to share the collected data with the nursing team and management to promote an environment of transparency and accountability. Clear communication pathways for sharing the data promote a learning and continuous improvement of culture across nursing teams. This information can be shared across venues through routine meetings, visual dashboards, and electronic health records access to information. This information may be translated and provided through real-time updates in the electronic health record, which is also EHR. These provide a forum to discuss existing performance measures, current concerns, and opportunities for improvement. By including members of the staff in these discussions, organizations can encourage group responsibility for patient care outcomes, thereby inspiring nurses to consider how their practice may affect quality scores. Research shows transparency and sharing information among nursing staff can increase performance, but also create trust between management and healthcare workers and increase patient safety. Recent research by Cara and Somez in 2025 draws attention to the beneficial effects of toolbox training for nursing sensitive quality standards. Structured education sessions focusing on the interpretation and application of data pertinent to these indicators have shown significant improvement in nurses' competence and confidence in their practice. The specific findings from the study included the enhanced ability of nurses to identify adverse trends, take proactive action, and apply evidence-based practice after engaging in toolkit training. Finally, the training fostered a good team culture as nurses communicated the data findings to their peers and management effectively. Implications of these findings show that nurses require continued education and skill enhancement based on data collection, dissemination, so that they are empowered not only to understand and use the collected input, but also to act on it and ensure that patient care can be improved. More than that, all nursing-sensitive quality indicators can be affected by data collection and dissemination. These processes underpin the quality improvement initiatives and empower nursing teams with the requisite knowledge and skills to advance patient safety and quality of care. Effective dissemination and adoption of rigorous data collection methods through a transparent organizational culture will help healthcare organizations prepare themselves for the complexities of patient care and achieve better health outcomes through these efforts. Investing in nursing education to recognize these indicators is an essential step towards excellence, as discussed in research studies by Cara and Somez. Nursing-sensitive quality indicators play a crucial role in enhancing patient safety, improving safety, as well as overall care. These indicators are precise indicators that represent nursing care delivered to patients, which are not fully influential for immediate but also for long-term outcomes. They offer key input into things like patient satisfaction, the occurrence of complications, and the efficiency of nursing interventions. Healthcare institutions can also identify gaps in care by tracking indicators of the care provided, enabling timely interventions to protect patients' well-being and quality improvement efforts. Several nursing-related sensitive clinical variables have been examined in multiple areas in the past few years, but obstetric care serves as a prime example. Measures like the rates of cesarean deliveries, the use of episiotomies, and neonatal outcomes provide benchmarks for comparing and assessing the quality and safety of nurse-delivered care during the birthing process. For instance, Luo 2022 have identified early elective births as an important nursing-sensitive feature. Monitoring this rate could help healthcare organizations take measures to reduce unnecessary inductions and their associated maternal and neonatal complications. This illustrates how the rigorous collection and analysis of nursing-sensitive features can be directly linked with improved patient outcomes. The way these indicators are measured is typically a combination of quantitative and qualitative measures. Quantitative data may include patient histories, incident reports, and clinical results figures, whereas among other things, qualitative data may be collected from patients through surveys and feedback mechanisms. By compiling this data, nursing professionals and administrators can better identify ongoing trends or issues, which can lead to targeted quality improvement efforts. In the case of a high level of postpartum hemorrhage cases observed on the ward, nurses can investigate further in detail and document the factors contributing to this event, leading to strategies and developments regarding measures to curb postpartum hemorrhages through higher standards of nursing protocol and education. Equally important is the dissemination of information related to nursing-sensitive quality indicators. This ensures that nurses at all levels are aware of what current standards mean and how they relate to patient care. Providing nurses with accessible feedback and data dashboards in ways that align with ongoing training opportunities, feedback loops, and best practices can empower them to continue positively impacting a culture of transparency and accountability. Nurses learn the significance of these indicators, which in turn leads to higher commitment and motivation to implement best practices in their work. Clear communication of data supports individual responsibility but also fosters collaboration as nurses work together to meet common objectives concerning safety and quality improvement for patients. In addition, incorporating nursing-sensitive indicators into continuous quality improvement mechanisms exemplifies the proactive methodology being used to increase care levels. The application of systemic quality improvement cycles like Plan, Do, Study, Act, PDSA provides opportunities for units to trial interventions aimed at increasing specific metrics. For instance, a hospital may test a new labor management standard to decrease avoidable cesarean deliveries. Systemic assessment of the outcomes will allow obstetric units to make adjustments based on current data to improve the quality of care. Thus, the rigorous application of nursing-sensitive quality indicators not only fosters improvements in aspects of individual care, but also promotes overall healthcare system accountability for quality patient safety. Indeed, the necessity of nursing-sensitive quality indicator systems as a key function in nursing standards is paramount for preserving patient safety while enhancing quality care. Fresh nursing educators working in a healthcare team need to understand these indicators and their implications in practice. Learning these metrics fosters an environment in which quality patient care is prioritized, reflected in better health outcomes, and ultimately increased patient and life satisfaction. Thank you.